A hearty good evening to everyone and welcome to our session on the care of newborn. We are glad to have Dr. Anibha Pandey among us today to help us understand the topic and to explore this important topic. It's important for us to understand that the mother and child go through numerous changes during the post-birth process, which needs guided expertise. We encourage the audience to ask our doctors any questions or doubts related to newborn care. So, doctor, you have the stage.
Thank you. A very good evening to all. I am Dr. Anibha Pandey, practicing as a neonatologist and pediatrician at Apollo Cradle Royal, Nehru Place. Today I am going to discuss with you all how to take care of your newborn baby. So, we all know that the birth of a newborn brings immense happiness and joy in a family. But along with this happiness, we have the responsibilities. What responsibilities? The responsibility to help the baby who was in an enclosed environment to transit to a new environment where they meet different kind of stimuli and get adjusted to that surrounding. So, parents who are going to deliver a newborn baby should choose a hospital with a well equipped delivery room with all facilities, comfort, and hygiene, and which has a close proximity to neonatal intensive care unit. A neonatal intensive care unit also should be well equipped with trained personnel and expert staff. So, this helps to tide over any problems which we encounter post delivery. So, 90% of the deliveries are quite smooth, but 10% may have complications and may require interventions for which trained and expert neonatologists and pediatricians are required. So, for this, the choice of the hospital has plays a very important role. Now, the first and foremost thing after the delivery, and if it has been an uneventful one, is skin to skin contact. The mother and the child has to be in contact with each other, and this helps them both in many ways. It helps to stabilize the respirations of the child, regularize the heart rate, and initiates the breastfeeding process in the mother. The skin to skin. The second thing is delayed cord clamping. So there is a cord connection between the mother and the baby. Now this cord is was the one which used to supply nutrition, oxygen, everything when the baby was inside the womb of the mother. And this cord is usually after the baby is born, this cord is clamped and cut, and this we delay for 30 to 60 seconds in order to give the baby a little extra blood so that his systems are better met off with, and even allay the anemia which happens later on in the infancy. So, after the delayed cord clamping, the most important thing is initiation of breastfeeding. So, we encourage the mother to start the breastfeeding process, latch the baby, and stimulate the baby to suckle at her breast, which is very important for the letdown of the milk. The first hour, in the very first hour after birth, we assess the newborn from head to toe in order to find any abnormalities if present and to treat them, and even to give an intramuscular dose of injection vitamin K. Now, vitamin K is very important to stop bleeding, and these newborns do not have enough stores of vitamin K. So we give it from outside so that there is no bleeding from anywhere like skin, the umbilical stump, or the intracranial bleeds. Uh, the baby is assessed, and if everything is found to be normal, is shifted to the mother as soon as possible, because the rooming in process is very important again to establish a successful breastfeeding. Breastfeeding process helps the mother as well as the baby, Breast milk is supposed to be the best, nutritious, easily available, and safe for the baby. And the breastfeeding process helps the mother also in several ways to get back into her shape, to prevent the development of cancers. And there are various important things which is benefited by this breastfeeding process. Now, as the child is with us, we do various screening tests for the baby. The most important screening test is the hearing test. Hearing is why is hearing test important is because if we find any problems in the hearing process, the baby is sent to the expert, and as early as possible we try to treat it. The next screening which we do is oxygen saturation measurement in all the four limbs to find out if any critical congenital heart disease if present in any of the babies. So if we can find it out, the baby can be referred to the expert and can be treated as soon as possible. Now, the third screening is done with the blood test, in which we take few drops of blood from the baby, and it is tested for the rare metabolic diseases which are treatable. And so, early finding out these diseases is always helpful for the baby. The fourth and the most important is the yellowish discoloration of the skin, which is called newborn jaundice. So, this jaundice happens in 60 to 80% of the babies. These babies have increased RBC, and therefore, when these RBCs break down, a yellow pigment is produced, and which leads to the yellowishness of the skin. So these babies are monitored on a daily basis, and if the level of the jaundice crosses a certain level, phototherapy is given to these babies. The treatment, if the jaundice is found within the first 24 hours, it's called pathologic jaundice, and various investigations and treatment would be required in that case. So the monitoring is of utmost importance in such babies. Now, the babies, these newborns have various other problems, like the umbilical stump of the newborn has to be taken care by keeping it dry. One should not use alcohols or any antiseptic creams till that stump is there, because it leads to wetness of the stump and delays the fall of the stump. The stump is supposed to fall within the 1 to 2 weeks of age of the baby. The urine and stools. The baby should be passing the first urine and stool within the first 24 to 48 hours of life. The stool in the beginning is that greenish black tarry type, which is called meconium, and gradually the color of the stools changes from blackish to light green and then to bright yellow. So this is the form of stools, and number of wet diapers is in turn is shows the adequacy of the breastfeeding of the mother. Before the discharge, we vaccinate the children with three birth vaccines. One is BCG, hepatitis B, and oral polio. And after counseling the parents about everything, we initiate the discharge process. So it's very important for the parents to be well informed and educated about caring of their newborn baby, and we assist in everything. I would welcome any questions from the audience if there are in whatever I have said, or any additional knowledge what they want to get from me. Okay, thank you.